सेम नहीं है, एक बार लाइव देखिए स्टूडियो टू, गूगल पे सर्च स्टूडियो टू है। इधर से कौन लाइव है।
डायरेक्ट स्टूडियो टू में चल रहा है। स्टूडियो टू में ही लिंक जो भेजा है कागज में उसमें काम नहीं कर sample law. Read up your question once more. A 35-year-old male presented with symptoms of headache, recurrent cough, fatigue, and weight loss about 10 weeks after returning from his trip to different parts of India. His blood and sputum examination did not reveal any pathogens. A stool examination viewed under light microscopy for routine ova and parasite, which revealed a finding that measured 88 to 92 micrometer to 47 to 48 micrometer egg. So please identify the pathogen to proceed to present your final clinical diagnosis of this patient. And I have given this picture of the egg. Okay. Now go to your DD values. My differential diagnosis are infectious causes, and few are non-infectious causes. In infectious causes, some are bacterial, viral, fungal, and parasitic causes. The question seems to having pulmonary TB, but we'll look for some other diagnosis. Here, some causes of atypical pneumonia like mycoplasma, chlamydia, legionella, and acute pneumonia causing strep pneumonia is also my DD of bacterial causes of lung respiratory symptoms. And these are the viral. No. So directly go to your sample which you have advised the patient. So my approach to the diagnosis is, firstly I will send some sputum sample for acid-fast bacilli, sputum culture and sensitivity for detection of Mycobacterium tuberculosis, and I'll send some blood culture and sensitivity for other bacterial causes which can cause pneumonia and chronic cough and weight loss. I will also send sputum for direct microscopy, like for fungal culture and sensitivity, and stool microscopy for routine ova and parasitic examination. Okay. What are you finding? In my if the patient is sent with the sample of stool, firstly we will do gross examination and then wet mount examination. Concentration method can be performed, but if I look for the stool sample for gross examination, the consistency, color, texture, odor, or any worm like any proglottids and glottids is if I can look for. Other than that, if I am doing wet mount, then normal saline wet mount should be done, and wet mount with iodine also should be done. And wet mount, we can look for motility of trophozoites, and in iodine mount, mainly we can look for morphological structures properly. So in wet mount, we have to report my stool sample is having, if I am reporting, then my stool sample if having any epithelial cells or epithelial cells for low power field, any pus cells it is having, any RBCs, any WBCs I can see. I have to report other parasites or any larva, any ova it have.
So what are the different concentration methods?
Concentration method, it can be sedimentation method, or it can be flotation method. There are two sedimentation methods: simple sedimentation, or next one is the formal ether sedimentation method, and there are also three flotation method: simple flotation method, release flotation method, Lane's direct flotation method, direct concentration flotation method, and another is ZNSO4 flotation method.
So which method do you do in your lab?
Sir, we are doing sedimentation method, which is formal ether sedimentation method.
How do you do it?
Firstly, we'll take 1 gram of stool sample, we'll add with 8 ml of distilled water and mix in mortar pestle completely. Then we centrifuge the sample at 3000 rpm for 3 minutes, and after centrifugation the supernatant will be discarded and will take sediment and will add 7 ml of formal saline and 3 ml of formal ether to this sediment, and this sediment will be again centrifuged at 3000 rpm for 3 minutes. Then we'll again throw the supernatant part and we'll use the sediment and we'll prepare a iodine mask and look under the 40x and oil immersion.
What is this technique called?
This is the formal ether sedimentation technique.
What are the other technique for concentration?
Concentration में simple concentration technique, concentration में sedimentation and flotation technique. In sedimentation, there is two: simple sedimentation and formal ether sedimentation. And in flotation technique, simple release technique and lens direct centrifugation flotation technique. Another one is ZnSO4 flotation technique.
Okay. What is the pros and cons of each?
In
When you will follow a flotation technique and when you will follow a sedimentation technique?
In sedimentation technique, we'll basically prepare a sample from sediment, and in flotation technique, the supernatant will be taken. So eggs, those cannot float, will be not able to we will be not able to identify them in the flotation technique, like eggs of Taenia saginata, eggs of Taenia solium, unabbreviated egg of Ascaris, and other operculated eggs will not be able to see in flotation technique.
Why they are not seen in flotation technique?
Because ma'am, these operculated eggs will be sink during a flotation technique. These will be heavy because of opening of operculum.
For which pathogen flotation technique is recommended?
For which pathogen? You can follow other.
For every stool, do you need a concentration technique?
No, ma'am. Only for formed stool, and if
Why
there is a
you
low
need
amount of.
why you need a concentration technique in formed stool?
Because formed stool will not be able to completely see under the microscope, because it is formed. Some portion will be thick. It will be thick layer, so will not be able to.
It's not the reason. What is written in the book? Formed stool has lot of debris. That's why you need your stool to be debris free, and that's why we go for concentration technique. Okay. So describe your stool finding. What all you did for the stool? Weight mount you have done.
Cross examination.
You have prepared how many weight mount?
At least weight mount 2 with normal saline and without iodine.
Why you need normal saline? Why you need iodine?
Normal saline weight mount should be done for looking for motility of trophozoite and bile stain egg. We can easily see bile stain egg in normal saline. In iodine mount, we can see glycogen mass and we can properly see the morphological features of organism.
So which one is better? What are the advantages of each?
In normal saline, we can definitely see the motility, and in iodine mount, we cannot see the motility because it will not able to move. And in normal saline, we can see the bile staining of the egg, but in iodine, we will properly see the glycogen mass, which will be stained by iodine, and it will look brown. In normal saline,
which one you should see first, normal saline or iodine?
Ma'am, normal saline, because we want to see the motility, and within 30 minutes.
Which parasite have which kind of motility? Any example?
Yes, ma'am. Ma'am, E. histolytica, it has pseudopods, so random iska motility hai, and Giardia, ma'am, falling leaf-like motility. Giardia lamblia.
These two parasite only?
Other flagellates also there, like ma'am Trypanosoma and ma'am.
Which are bile stain? Give example of some bile stain and non-bile stain.
Non-biostend eggs are Nicator americanus, Enterobius vermicularis, um, H. nana, and Ankylostoma duodenum. These are non-biostend. Other than that, are biostend.
Carry on. So what did you do next?
So after wet mount, I will be doing concentration method. I already explained the concentration method, sedimentation and flotation.
Which method you have done?
Here I have just given with the diagram only. So I can explain the finding of the wet mount. So here they have found an egg which is oval in shape, unembryonated. The size of this egg is 47 into 92 micrometer, and this egg is operculated, and the abopercular egg, portion of the eggshell is thick.
So what is your DD? So looking at the size of the egg, what is your DD?
Ma'am, I am suspecting operculated non-embryonated egg, which can be Paragonimus. Other than that, fasciola and fasciolopsis can be there, which are lung flukes, liver flukes, and intestinal flukes. Basically trematodes, except cystosoma. And another DD can be one trematode, which is Diphyllobothrum latum, which is operculated egg.
Among all this DD based on the egg size, which can produce a lung symptom?
Lung symptom can be produced by Paragonimus species. Other than that, Ascaris lumbricoides hookworms.
But Ascaris egg will not be
It will not be operculated.
So your DD is only Paragonimus.
Yes, with these features.
So Paragonimus, what percentage you find in stool?
In sputum stool sample percentage of Paragonimus, ma'am, 25 to 62%.
It's a wide range.
Yes, ma'am.
And in sputum?
In sputum, it can be 55 to 72%.
How many cases are there? What percentage are there to have a sputum negative but a stool positive?
If and this kind of study I am not able to see yet, but sputum is more basically sputum will be positive in 80 to 90% of cases, but stool will be positive by just in 60% cases of these patients. Okay. Because if the patient is the adult, so he is most probably these adult patient are not able to, like, they are not swallowing their sputum, so stool sample will not be positive for these kind of eggs every time.
And then now you have conversed to Paragonimus. What is the treatment?
Ma'am, treatment is mainly drug of choice is the praziquantel. Praziquantel 25 milligram per kg TDS for 3 days. Bichionol, which can be given as the 40 milligram per kg BD on alternative days for 10 to 20 doses. And cyclopentazole is also advised 10 milligram per kg single dose.
What is the life cycle of Paragonimus which you have shown?
Life cycle of Paragonimus is first the human is ingested with metacercarial larva when he has cooked or pickled crustacean containing metacercaria. This then these metacercaria will be firstly this then excitation of this metacercaria will go into the intestine, and it ruptured the intestinal wall, and it comes into the peritoneum. Then it goes into lung alveoli, where it forms a capsule in which it will be developed in larva and give their larva and adult and give their eggs to this cyst. And when this cyst will rupture, these larva and eggs will come to the sputum, and this sputum is then swallowed by this patient, and it comes into the stool. When this patient passes stool and sputum, and this stool and sputum containing eggs which have miracidium, and when this miracidium containing eggs contacted with uh, water bodies, the the miracidium will infect uh, snail. So these Paragonimus has direct host, which is human, or intermediate host, two intermediate hosts. First is snail, and second one is the crustacean. So this snail will be infected by egg which is containing miracidium, and this miracidium will then develop into sporocyst. Sporocyst then develop into radia, and this radia develop into cercaria, and this cercaria then leave the snail, and the cercaria develop into metacercaria, which infect the crustaceans or crab.
What is the Indian epidemiology of Paragonimus?
In India, 6.7% of the cases found in northeastern countries, northeastern areas of the country, like Manipur and Arunachal Pradesh. So human Paragonimus is shown by this red mark only. So here this Manipur and Arunachal Pradesh is showing only human Paragonimuses, and first case was shown in Maharashtra also, which were actually the not indigenous case of this Paragonimus.
Okay, there is no there is no question yet, so I think we can conclude. Yeah. Okay.
So, on the basis of history, clinical symptoms, and stool examination, my provisional diagnosis is Paragonimuses in this patient.
Okay, thank you. I think no question yet. We can conclude. Just wait for another 2-3 minutes. Yeah. There is no question. Conclude.
Thank you.
Yes, ma'am.